Hey everyone, thank you for joining us again for another episode of Mind Split Cafe. Today's a little different. Today's special. We're actually partnering up with the gold standard of healthcare, DHR, and a couple of their clinicians. So today, of course, we have Matt Palmquist with us as always,
Hey
and
guys.
today, and we also have Mariana with DHR, who is an LPC, licensed professional counselor. And Mariana, why don't you go ahead and take it away and introduce yourself and talk about your background and why you're here with us today?
Okay, so my name is Marina. I'm a licensed professional counselor, LPC, right? I've been working at DHR Behavioral Hospital for about, what is it, 4 years, over 4 years. And I work with children between ages 3 to 12.
Wow.
So worked with a lot of age ranges, but particularly with children, which is always fun, right? But at DHR Health Behavioral Hospital, it's a short-term facility for individuals who are in crisis, and we see all kinds of patients from ages 3 and up.
Wow.
Yeah.
Awesome.
Wow.
Well, thank you for that quick introduction, and we're glad you're here. We really appreciate you guys taking the time to
Uh,
be with us and partner up with us.
yeah.
Just a little side note. I played basketball at Pan Am in the late '90s, and I remember driving down McCall, and DHR was just in a small building, outpatient. It wasn't even the campus that it is now. Like to see the growth and how it encompasses everything. When they first built the hospital across the street, the women's hospital, and they had the crossing guard, like that was a big
I
thing,
remember
right?
that.
And so now you have this huge campus and now you got behavioral health, and it's just kudos to DHR. They are the gold standard. So yeah.
Yeah, no, every day I feel like there's a new building popping up, which is great because
Yeah, it's
more.
an
Yeah,
amazing, it's an amazing triumph. Yes, it is. But go ahead.
yeah.
I'm
I
sorry,
grew
Marina.
up. I grew up around DHR with my dad, so it's awesome to see the growth, and it's just you guys continue to grow, so it's
Yeah.
great.
So
Super excited.
you mentioned in your intro that you work with kids. What exactly do you do? What can you share? Because I know HIPAA and everything, but what exactly how do you help or treat these young individuals, these young kids?
So, I see, we're able to see kids from ages 3 to 12. However, I don't really see too many 3-year-olds. However, we do have availability for that, right?
Okay.
Um, Typically, the hospital is for individuals who are going through a crisis. So that could look like somebody who is, experiencing thoughts of wanting to hurt themselves, hurt others, or are in active psychosis,
Mm,
have very aggressive tendencies, sometimes very impulsive. And usually with children, what we do is have a multidisciplinary team to evaluate the child. And part of my role there is to kind of talk about safety with parents and with the child, right? But we also provide two 45-minute psychoeducational groups. And, we teach them about, emotions and how to regulate those emotions. So we do a little bit of that, right? Children there are typically only there for about 3 to 5 days. After that, we set them up with an outpatient therapist that can continue with that. So my approach is mostly, safety planning, solution focus. We identify why they're there and set them up with maybe the resources so that they can continue with care.
you brought up a question that just when you were talking and that kind of sparked, you know, what are some of the triggers, because it's an inpatient, so you said
Yeah.
that people come to see you for a couple of days or 3 4 5 days, whatever it was, right before they are let go, and now they see treatment outside. But what are some of the triggers or the identifiers for a young child that says, for a parent that says, or a school that says, hey, we need to we've identified this child and they need to go see Marina at DHR? Like, what are some identifiers to where they need to
Yeah,
kind of kickstart?
so, if a child ever voices that they want to harm themselves, they would definitely refer this child to a behavioral hospital for assessment. And part of that is, they talk with either a licensed professional through mental health or a psychiatric nurse who then staffs the case with a psychiatrist. And then the psychiatrist determines if they meet criteria to stay. So if a child comes in because maybe their teacher heard them say something like, oh, I don't want to live anymore, they probably would refer them to the school counselor, who then refers them to a behavioral hospital. And from there, our intake coordinators, who are either an LPC, licensed professional counselors, or an RN, would then get that information and report it back to the psychiatrist, who then determines if they have to stay or not.
So there's some physical, or at least verbalizing things like that is considered a warning sign. But what are the physical warning signs? Like, is there anything other than verbalization that can be a warning sign or a red flag?
So it could be anything from, self-harm. So sometimes children are cutting themselves. It could also be that aggression or impulsivity, if they become angry easily and do things like run across the street, that would be a behavior that we would definitely need to watch out for, as they are a danger to themselves, right? Don't want anybody, running across the street when they're angry. So they then refer them to us. So those are typically the kind of scenarios I see with children, is the self-harming or that impulsivity where they have tried opening a car or have
running with knives
or have grabbed a knife, right? Those are other behaviors too, that they grab knives or things like that. So definitely will then be referred to us, and then we'll see if they need to stay there for additional services.
Just out of curiosity, I mean, I'm sure you treat kids from all over the state, right? But how many kids do you see on an annual basis where they've been identified? And
that would be very difficult to kind of guesstimate. I wouldn't know, but we do have I believe we have up to 15 beds for children. So each unit is able to house about 24 patients per unit. So we have 4 units. We have our psychiatric unit for children, our adolescent unit, our adult unit, and our geriatric unit. The children's unit is smaller, so we're usually able to see 15 at a time.
Wow. And you are at capacity, I'm assuming? I'm just trying to get an idea of the need.
It just depends, right? But yeah, typically we do have a good amount of children there. We see children from all over the area, right? So typically in the southern area of Texas, because that's where we're located. Sometimes we get referrals from other parts if there is no beds in that area, meaning that there's not an availability in their hospital.
How long has your department been in existence? I mean, like, we talked about how DHR has grown, how long has your department been? You said you've been there 4 years. So.
Yeah, I've been here 4 years. I believe behavioral hospital has been there for about 15. I'm not exactly sure, but it's been there for a while. And so my department has been there since then.
So I have a question with treatment, or at least along the lines of treatment. I know there's various different types of modalities that are used in mental health. Can you walk us through a type of treatment as far as talk therapy, or what happens when someone is there in the unit?
Okay, so yeah, a lot of my approach is, like I mentioned, safety planning, more psychoeducational, because they're there for a short period of time. We cannot do the treatment that you would see in outpatient, right? Outpatient is where, you see a therapist maybe on a weekly basis for about 45 minutes. Here, because of the short-term stay, we usually provide them with more of that education solution focus. We focus on the reason that they're brought there and kind of identify, what can be done to manage that, right? So for example, if somebody is struggling with bullying, right, although there might be other, factors that may have led them to feel, suicidal, if at the moment the triggering factor was the bullying and that's how it was identified at school, right? We then talk to the family and kind of get that addressed. Okay, mom, this is what's going on. This is something that needs to be addressed with the school because your child's continuing to feel this way based on the bullying. And then we find options to see, how they are able to get back to school, right, without feeling that anxiety and fear of being bullied again, right? So I'm mostly focused on the presenting problem, identify the triggers, and provide them with crisis numbers.
And what kind of follow-up is, you say they're there for a couple of days and then they're released. But what kind of follow-up on your department or you guys in? Do you try and reach out to the parent like 6 months later, a year later? Like what? I'm just curious to know.
Yeah, for
if
sure.
there is follow-up.
So typically what we do is we provide their initial appointments for their health providers, right? So we'll make an appointment with a psychiatrist because usually once they are admitted to the hospital, the psychiatrist, sometimes provides them with medications or prescribes them with medications. And so they would need to see the psychiatrist to follow up. As far as therapy goes, because I'm inpatient, I don't see patients outside. I wouldn't be the one following up with, providing those therapeutic services. However, we do set them up with a counselor in their area. So if they're from the Westlaco area, which is another city nearby, we would provide them with a counselor in that area so that they're able to go. And in addition to that, we do another appointment with their primary care physician so that they can follow up with those services.
So it's not just like set it and forget it. Like, hey, you've been, released and just on to the next kid. You guys are really doing the steps to ensure that the care is continuous to make sure that the kid has everything that he needs the tools to continue.
Yes, and of course,
fantastic.
I do like a talk with the family about making sure that they are aware when these appointments are, how important it is, so that there is that continuity of care.
Yeah, it sounds like there's a lot of people involved in treating this. Now, does anything ever get lost in translation? With there being so many clinicians involved, or do you guys? I mean, it sounds like you guys kind of have it planned out and step by step.
Yes, no, we definitely have protocols so that way nothing gets fallen through the cracks, right? We have a good team that has been there for a couple of years, and most of our nurses are assigned the same unit so that nothing falls through the cracks. So my charge nurse is the same charge nurse. We have like two, and we switch throughout the week.
Nice. Well, I want to go back to the bullying real quick. I know kids are mean nowadays, just extremely mean, especially on the internet. So is bullying one of the most common factors or driving factors that you see when kids come into your unit?
It could be anything. It could be, a family, going through a divorce, right? That could be a triggering, and there's like that custody battle. And it could be a trigger for children, right? Having to pick, what's going to happen or what, just dealing with that stressor. Bullying is another one. Social media can be a trigger too. When parents take away the access to social media, that could be a trigger.
It's funny that you say that because I mean, I'm a seasoned adult, right? When I say seasoned, I'm a little old, right? But when I was going in middle school, I was bullied, and like all kids were. And I don't want to say the great thing about being bullied back then was you were only getting bullied 5 days a week for like 7-8 hours a day, you know. And then
Only.
when you left school, you got a break, and then when you went Saturday and Sunday, you pretty much got a break, and then it was just back on Monday, right? Because there was no social media, there was no, kids couldn't reach out to you via, you know, social media, right? We didn't have it. We had VHS tapes. Like, no one's going to send a VHS tape, right? And so
Or a
I
little
think,
cassette recording of it.
yeah, like, hey, you know, like, let me record B104, right? And get, you know, so anyways, but um I think now with social media, because my son grew up in that social media kind of, and I remember seeing him and how it had affected him in some instances. It wasn't as bad where we needed to go see, you know, a professional like you, but you could see the bullying where it reached him after school, not
No, for
just
sure.
during school. It was, you know, on a Saturday because someone left a comment or sent a message via direct. You know, it was that thing where they could they could reach out to you and touch you at any point, not just, you know, at school anymore, you know. And
Yeah.
so
And what's scary too is that it's at a social level too. So not only is the bullying just happening in private,
mhm,
sometimes the bullying can be where the whole school can see and
oh yeah,
basically anybody online, right? Some of the create fake accounts with pictures that are embarrassing,
mhm.
or impersonate one another, pretending to be someone else. And, it's just, it is a lot harsher, I would say now. So I could see how that could be definitely a trigger.
And do you see a lot of those cases where social media has the negative like
Yeah, for
role
sure.
in it?
Yeah, for sure. Yes, like I said, online bullying or just with electronics, it's kind of one of those controversial topics, right? So as parents, you don't know, how much screen time is enough screen time. And so
Of course.
sometimes when a child wants to maybe interact with their friends, and then it's like, okay, it's time to go to sleep or it's time to stop, that could be a trigger for some children, especially if have a they have a very close friendship group and they rely on them for emotional support. So if you take that away, sometimes that could be a huge trigger. So I do see a lot of that where, no more electronics, or you can't talk to this person, or um, now I'm having to monitor your online use because, maybe you're too much online, and that could definitely be a trigger for children.
Wow.
Yeah.
So it sounds like, and even in our past episodes, it kind of sounds like social media is the culprit, or at least the starting factor in a lot of things. Now, have you ever seen social media being in a positive light for someone that's in this situation, that has helped them being able to interact with their friends or even groups,
And find
online
strength.
groups?
Yeah, like a community, you know, where it's
Well,
like, yeah.
well, with kids, because they're so small, I think it's kind of difficult to say, right? Because sometimes they shouldn't be talking to strangers online. But for teenagers, or maybe older adults, I think it can be a positive resource, right? You're able to look up help. I know that now with the change of the suicide number, right, 988, you can now get online and chat as well. You can text. So I think there is a positive aspect when it comes to electronics and online. As far as social media, I think it can also be positive in that you can find people to relate to and you don't feel so alone, right?
Hmm.
But if you're very small, sometimes you should have that online supervision, right?
Of course. And you
Mhm.
mentioned there's a new hotline 988. Is that what you said? Did I get that
That is
correct?
correct. I think that came into effect in 2022. So before, the Lifeline number was 1-800 and a couple more numbers, right? So I think it's beneficial to just have it at, three numbers now.
Especially,
Yeah,
yeah.
they made it a little easier.
Yeah.
Yeah,
I mean, everybody knows 911, right? And so now 988. Wow. Now,
So
let
yeah.
can
me
we
ask
put
you
that
this.
right here, Matt? Can we
Oh,
put
yeah,
that
I'm
right
going to
here for all the
sprinkle it right
listeners?
here. Sprinkle it
Yeah,
right here.
somewhere around here.
Yeah.
Again, I'm not sure where it's going to go, but somewhere on the screen.
988. But what kind of effect did the pandemic play, like
I would
as far as mental health?
I would say that it probably played a huge role, right? Just because, there was that level of isolation.
Hmm.
I did see a lot of children feel comfortable being back at home and doing homeschooling. Maybe you saw not many instances of bullying anymore, right? And so now you're going back to school and having to adapt to that. I think
Yeah.
it does play a role, right? It can cause some children to feel maybe more vulnerable now, especially when they were feeling comfortable at home.
Yeah.
Um, but at the same time, you can also see how it can uh, have people feel isolated, right?
Yeah.
A lot of people lost their jobs too. I had some
And
friends that
there's a conundrum to it too. Like you said, some of the kids that you witnessed, that they felt more comfortable being at home, being homeschooled, and it was safety for them. But then
Mhm.
on the flip side, the parents that now have their kid, they're the mom, they're the dad, they're the teacher, they're the disciplinarian, the principal, like everything. Like what kind of effect did that have on not just the younger adults you saw? It was a good thing, but did you see any ill effects from the pandemic with the parents now that they're schooling and homing and all this other stuff
Yeah, it, it
24/7?
it was a stressor for many because they relied on the children going to school as a form of care, right? Like they didn't have to
Hmm.
get child care. And so now it put a stressor on the family members financially right now, having to find, you know, somebody to take care of their children when they're working. Also, if they're, financially struggling, school provided them that school lunch and whatnot. And here, you're
Hmm.
having to find food for your children. So I think it probably did take a toll for a lot of families because a lot of our referrals are also from school. We maybe not a lot of children were identified that needed to come to
Oh,
the
wow.
hospital. Or I also heard from other colleagues saying that whenever abuse is identified, it's usually at school. So that was also another factor that made me think like, okay, so some children are probably not getting that intervention that they needed if they're being abused at home.
Yeah.
So I know a lot of mental health issues or concerns. They don't discriminate whether socioeconomic status, whether you got a dad that is an attorney or you have a dad that's working a blue collar job. It doesn't really matter where you're at socioeconomic status. This still plays a factor in everyone's life, correct?
That is
I mean,
correct.
this can affect anyone.
It can affect anybody at any age. Sure, there are some risk factors, and part of that risk factor is not having access to care, right? And
Hmm.
finances does play a role in that, but it does not discriminate. We have a lot of celebrities that have unfortunately taken their life, right? So,
Hmm.
um, it can affect anybody, any role, any age.
Let me ask you this, because I mean, I spent time down in the valley playing basketball, and I lived there post collegiate career. But culturally, does that come into play where there's a pride factor, like where it's like, my child, yeah, like it's a dismissive kind of mentality where Mijo's just getting bullied and he'll be fine, and so they don't take the steps to really, really, you know, seek out the help and go find someone like yourself. How does
Yeah,
that come into play?
there's a lot of stigma right behind mental health, right? A lot of people think that you have to meet a certain criteria to be able to get help, right? I'm not to that point yet, so I don't need to see a therapist. I'm just
Exactly.
talking about mental health in general, right? Not
Yeah.
because there is a certain percentage of people that will never go to a behavioral hospital because these are for crisis, right? So unless you're experiencing a crisis, you wouldn't come to the behavioral hospital, right? But just to seek out therapy, right? You don't need to meet, you know, a particular criteria to be able to
Of course.
talk to a therapist, right? So
Yeah.
yes, there are cultural factors that may, minimize the likelihood that you'll see a
Exactly.
therapist. But I cannot speak for the parents that I've seen, because sometimes, I mean, they're there, they're seeking
They're
help.
there.
So
Yeah.
yeah,
And
so it would be
kudos to them. Yeah,
hard.
kudos to them that
Um,
they've taken the steps to do so. Like,
yes, but
yeah,
I definitely do think that different cultures probably play a role, whether it be a religious, upbringing where they're like, no, you're good, let's just focus on going to church, or whether it be cultural where you're just being chiflado or chiflada.
yeah,
But that's why it's important to kind of educate and bring awareness to this, that mental health is just as important as physical health, right? If somebody was complaining of a broken arm, you wouldn't just say like, oh, get over it, you're just being
yeah.
chiflado.
Are there any, I mean, we're running close to the end here, and time has flown by. So I told you it would, right?
Yes.
It, you
It
know,
is quick.
but are there any, um, are there any like at home kind of like breathing techniques or something that you could possibly, if they're going through something, like they could possibly just kind of would you recommend, is there something that you would recommend for them to kind of try and do at home, just to kind of like a quick remedy or a bridge?
So of
Or
course, if anybody is experiencing an actual crisis, for example, having thoughts of wanting to harm themselves with the intent or harm others, of course, I think that at that point you should call emergency
seeking help.
services, right?
Mhm.
But if you are experiencing feelings of depression, anxiety, definitely you want to kind of practice, healthy coping skills, right? Reach out to your emotional support system, identify that emotional support system, whether it be a friend, a family member, um, and of course practice things that help you feel good, right? So whether it be exercising,
Mhm.
journaling, being outside, but when somebody is experiencing strong feelings of sadness, depression, there's that lack of motivation sometimes. So reaching out to your friends who are kind of isolating and just checking in on them, right?
Yeah.
Seeing if they need something, because I think what really helps is just having somebody to listen, right? And share that feeling with you as well, showing empathy, right? Non-judgmentally.
Well, Marina,
Yeah, absolutely.
you have blown away your episode, and you're more than welcome to come back anytime you want to discuss, any topic that you want. If you want to come back and talk baseball, we can. So, I'm just kidding. But
I don't know anything about baseball, so that would not be good
well,
episode.
if you want to come back and talk about UTRGV football, you can. So it doesn't, whatever. But thank you so much for joining the show and lending your expertise and your knowledge on such a growing topic. I mean, this is affecting millions upon millions of people, not just adolescents and youth. So thank you so much for lending your time,
No,
Marina.
thank you, and it's been great. It's great being here. Yes.
Yeah, absolutely. Thank you. And what I'm going to do is I'm actually going to extend this episode a couple more minutes because I'm going to ask you one last question.
Okay.
Uh-oh.
Awesome.
Bonus question, Marina.
Yeah, what is the best advice you can give to a parent with someone, what to look out for? I know we went over some warning signs, but what's the best advice for a parent that may be experiencing this?
I think just having that time to listen to your child, right? And being empathic and non-judgmental. I know a lot of kids tell me that they were scared to talk to their parents because they were scared that they were going to get angry. They were scared about their reaction. So just listening to their child, and of course, some warning signs could look like if your child is isolating, if you notice that your child is just in their room, just on their phone, um, just kind of checking in on them, maybe having that individualized time. I know a lot of the kids also explain that they're not used to having a sibling. Maybe there's a new sibling or a new
Mhm.
stepmother or stepfather, and so the attention has been diverted. and not intentionally, right? It's just that now there's a new family member. And so, getting used to that adjustment and feeling like maybe they're no longer part of that family. So just
Yeah.
kind of, having that 10 minutes, 15 minutes to kind of check in. So just checking in and listening to their children.
Awesome. Well, thank you for that.
Fantastic.
Thank you for answering that bonus question.
Yeah. You're the first
you.
guest that's ever gotten a bonus question, by the
I
way.
know.
That's how great you've been. So
I was kind of getting anxious there. I was like, okay, I hope it's not a hard one.
if you're getting anxious, I know somewhere where you can go. Shout out to
Thank you.
DHR, the gold standard, right? So
Yes,
Yeah,
for sure.
absolutely.
Mental health is important for everybody. Therapy is important for everybody.
of course.
Absolutely. I agree with that. And that's our mission with this podcast, is to, let everyone know it's okay not to be okay all the time.
Yeah,
And
sure.
normalize mental health.
Yes, for
Yeah.
sure.
Everybody needs to find somebody, right? So thank you so much for joining the show. You're welcome back anytime, Marina. We loved having you. And yeah, so thank you again.
Thank you.
Yes. Thank you, Marina. Thank you, DHR. You guys are awesome. Once again, the gold standard in healthcare. And I can't be more excited that you guys have partnered up with us on this. Thank
Of
you
course.
very much.
Take care. Till next week, guys. See you soon.
Thank you.